Hello everyone, my name is Pauline Tipanero and I'm going to talk about depression in public health. So what is depression? According to the DSM-4, depression is defined as a common mental and medical illness which negatively impacts people in mild or severe cases, and it also alters and interferes how people operate in their day-to-day lives. Epidemiological studies actually shows that depression is one of the most common mental disorder, along with anxiety. Some of the symptoms that are also from the DSM-4, which is like a book that kind of like has a criteria for depression and all of the other mental illnesses. Like the diagnosis for it could be, these are like the physical symptoms, so it's like tiredness or fatigue, too much sleeping or lack thereof, changes in appetite, like eating more, eating less, which then results to like weight loss or weight gain. There's also like a neglect in hygiene and sexual problems that like comes along with this. On the right, there's actually a photo depicting how the body is like impacted with depression physically, which is kind of like a good indication how much depression like really affects your entire health, not just your physiological or emotional health. More symptoms of depression are like the physiological and emotional symptoms, which is sadness. There's also like a loss of interest in like your activities that you once liked. There's difficulty concentrating, and memory loss are also like a really big part. Like if it gets really bad, there's like delusions, hallucinations, and then like thoughts of self-harm and death, like suicide, like which is like the extreme of how depression can really get. Obviously, like the forms of symptoms may vary from person to person. Some of these may be true to other people who may not even have depression as well, or there's like symptoms that are it's only like depression if the symptoms are clearly interfering with your life. I think it's also crazy how some of these symptoms are like easily neglected and not really easily associated to depression, which goes to show how easy it is to like overlook this disease. So you may ask, like, what causes depression? So some possible causes for depression can vary from family history or genetics. Like there's like changes in hormone levels, which is like through pregnancy or some other stuff, like your monthly cycle. There's that too for women. Medical conditions can also like, because it triggers stress. Grief or traumatic life circumstances is also a big part. Substance abuse, and it could be like chemical imbalance in the brain, which like kind of like is more through like the lack of norepinephrine, glutamate, and GABA, which are responsible for mood and emotional regulations. So when a person has depression, the communications between the nerve cells are lost and it becomes inefficient, which creates a noisy environment for mood regulation in the brain, and thus possibly contributing to depression. So, how common is depression? Depression and mental illness is actually a lot more common than people think. According to the National Institute of Mental Health, 1 in 3 adults in the United States is affected by mental illness in their lives. And in addition to that, mental health statistics also show that depression alone affects nearly 21 million people in the United States and about 250 million globally, according to the World Health Organization. So I think with the recent pandemic and the growing problems worldwide with the wars and stuff, I'm sure the numbers are just inevitably rising. With the statistics, it is vital to like critically assess depression as a major public health concern. Public health also emphasizes the differences in one's health in terms of social positions. So depression is most likely like a no-brainer for that. So you can see on the top of the graph right here, adolescents, adults 18 to 25 are documented to have like the highest levels of depression more than any age group. And although ethnic minorities are seen to have like high levels of depression because of the stressors and like the discrimination around their communities, it is still also significantly high in white populations, and there's also the biracial populations in the United States. The graph also shows how it is more prevalent in women, which is like almost twice more likely to report depressive episodes than men. And additionally, LGBTQ population has higher rates of depression than cisgender people, according to the CDC. On the bottom of the graph, it shows the prevalence of depression in regards to socioeconomic positions. It shows how persons who have achieved a greater level of education results in higher income, which also results to less depressive episodes due to the improved resources. So family incomes that are less than 100,000 a year, which is over here, like right here, they often have more rates of depression than people who are in a higher income bracket. I don't know, like I think it kind of shows how like money can buy happiness. Oh, I'm just kidding. But it is also evident that depression may be more common in subordinate positions that experience intersectionality in society, such as like groups of races, like race and gender, like women, and like LGBTQ communities. So some of the depression treatments and preventions, so like the first one is the primary prevention, which is like kind of like just preventing the depressive episodes. So like some parts of that could be just understanding the stress that you can handle. So if you're a student, you can understand like how much stress you can handle each week, and then understand when to stop or when to kind of like take a pause. Exercise is also really good, and meditation. Good sleep schedule is also very important, and surrounding yourself with positive people that won't steer you to like wrong directions is also really critical. For the secondary prevention, it is more aimed to minimize the damage of depression in the depressed patient, which reduces the course of the illness. So this could be through screening programs, early diagnosis and treatment, and therapy. I think therapy is probably like a really good way to do that, because you can vent out your feelings and somebody will listen and really will allow you to become more self-aware of your surroundings, and even if you're diagnosed with depression or not. For the tertiary prevention, it will seek to cure or stop the relapses of depression. So this could be through antidepressants, rehabilitation, psychotherapy, which is like this one, the electroconvulsive therapy. This would like produce like shock waves on your brain, which is more of like probably like where it's if you really think you really need it. The graph on the right actually shows like the research study about antidepressants, and it shows how 40 to 60 out of 100 people who took antidepressants noticed an improvement in their symptoms within 6 to 8 weeks, which I guess it proves how antidepressants really are effective. So a little recap on the discussion. In this presentation, the mental condition that is depression was described as an illness that negatively alters how you feel, think, and operate day-to-day activities. Although, as I mentioned, this is a common illness, it is often left untreated due to the long stigma associated with it. In the lens of public health, depression is also often seen in positions of subordinate, such as like genders of women, LGBTQ+, and even like the lower socioeconomic classes. Although depression is one of the most common mental illness, it is still rapidly increasing in the world, especially as the world becomes more and more connected through like technology and media. However, it continues to still be stigmatized in society due to the lack of awareness and acknowledgement of mental illnesses. And lastly, treatments for depression may be extensive, but it is essential to allow a person to live a long and prosperous life. So here are the references I've used, and thank you for listening.